Thank you guys for joining us. I know a lot of y'all are tuning in at home. So big thank you for joining us today. We have a live discussion with Dr. Samaniego. He's our Chief of Obstetrics and Gynecology at Kelsey-Seybold. I'm Lane Galata. I'm one of the members of the marketing team here at Kelsey-Seybold. I'm also a mom of 4 little ones, so I've been where you guys are going through pregnancy, actually as a Kelsey-Seybold patient as well. The OBs at Kelsey are wonderful, and I know y'all are all very well taken care of. So before we begin today, we just want to run through a few housekeeping things since some people aren't very familiar with Zoom or webinars. If you could please mute your microphones just to make sure that we eliminate any background noise so all of our participants can hear us. I know some of us have kids running around at home and pets and things like that, so we just want to make sure that we have everything muted so everyone can hear. If you have any questions, we 100% invite you to type those into the chat box or the Q&A box, and Dr. Samaniego and I will field those as we go through the webinar and make sure that we get all your questions answered. As always, if you have any questions about your pregnancy at Kelsey-Seybold, please call your OBGYN. They're happy to answer them. You can reach them during normal business hours at their office. And we also have the 713-442-BABY number, which is the after hours line. So if you call that on nights or weekends, an after hours nurse will actually answer that call. And if a doctor needs to be paged at that point, they'll page the on-call doctor. So we always have a doctor readily available to help, and we always have nurses on hand to take your calls as well. So we're going to go ahead and jump right in. COVID-19, also known as the coronavirus, is why you're all tuning in today. So Dr. Sam, can you tell us a little bit about what is COVID-19 and what do we know about how it's being spread so far?
Right. COVID-19 is a is a virus. It's a certain type of virus. It has a fancy name called a coronavirus, and that just identifies it. And it's a group of viruses that have been circulating the globe for a few years. This most recent one is kind of a new variation. And when it starts circulating the world, we refer to it as a pandemic. We call it the novel coronavirus because it's new. Right now, as we're talking about pregnant patients, we've got about an estimate of about 100 million women worldwide that are pregnant, and then of course their babies accordingly. So it's kind of a big deal for the obstetric and gynecological community to be thinking about that. The way that it's spread in the same way that the flu is, something we're very familiar with. When somebody sneezes or somebody coughs, that saliva carries a little bit of virus with it, and it can spread to surfaces, or it can spread to our mucous membranes, like our eyes, our nose, or our mouths, and we can end up taking it in that particular way. So that's how it's spread. Now, there's been some talk that it spreads a little easier than the flu. I'm not entirely sure that that's true, but we need a little bit more research to kind of tell us that. Maybe the amount of virus that's in the aerosolized saliva that's required to cause the infection is less. I don't know. We'll have to see. But my gut feeling is that it spreads about as easily as the flu does. Probably not any worse.
And what are we doing here at Kelsey? I know on the backside of things, y'all are on calls and meetings and keeping up with the CDC, but what are we doing to protect our patients and staff from spreading coronavirus?
Right. I mean, we're actually doing quite a bit, and it's many levels, and it affects really all the levels of the organization, everything from how we clean things to how we bring patients into the office and how we take care of them, and then how we interact with them directly. But more specifically, the big thing is social distancing. In other words, we know that when we implement the separation of people from each other and selectively let the people into the office that don't have the illness, we're going to keep that from spreading to other patients. And so to that end, what we're trying to do at Kelsey is move as many patients as we can to visits that are not specifically person to person. In other words, they're virtual visits, like a video visit or a telephone visit, as much as we can. We've also limited the patients coming into the office. Those patients that are coming just for screening things, we're going to delay that a little bit. Not forever, just until this thing passes. But for the patients that do need to come in, especially patients that are pregnant at the very end, or periodically through their pregnancy, we have them come into the office. And when they come to the office, they're screened at the front. And by the way, so are we. All of us are screened. And that involves a series of questions and also taking of our temperature. And we'll get back to that a little bit later in our discussion. But both the patients and the doctors are screened. So once you get into the building, it's a pretty safe place. When you are dealing with the doctor, sometimes, and these things may change because they're very, very fluid, sometimes the doctor may be wearing a mask, and that's probably going to become a little bit more common, to try to separate whatever we're breathing from you and whatever you're breathing from the caregivers. The interactions are at a distance unless we have to do an examination, and we try to limit that as much as we can. So that's kind of what we're doing at Kelsey.
So moving to video visits, is that a trend that we're seeing across obstetric practices in the US? And if it is moving that way during the COVID pandemic, what advice do you have for patients to kind of prepare for a video visit? So, is there anything you want patients to do at home to prepare for that?
Well, really just the same thing that they're doing. I mean, when we're together physically in a room, of course, we can sort of touch each other, and listen to your heart and lungs and that kind of thing. And so the only thing it requires really is an increased level of communication. So maybe sometimes it's better to perhaps even write down what you're thinking or what you're worried about, because we're limited by being able to speak to one another. We can see each other physically, like in a video visit, but in a telephone visit, it's a lot like a telephone conversation. And so writing things down and keeping that thing handy, as we interact together, that probably is the thing that helps the most. And of course, every region and every practice has slight variations to this. At Kelsey, we've got My Kelsey Online that allows you to be able to interface this way. And in other practices, if not everybody is from Kelsey that's listening to this, they may have another variation of that. And so, check with the office. That's probably the best way. And for example, at Kelsey, we've got lots of dedicated people to help you be able to connect so that that can be accomplished. And that can be done just by simply calling the office.
So what can expectant moms do to protect themselves from COVID-19? Should they be taking any additional vitamins, continuing their prenatals, any extra steps they can take to prevent themselves from being exposed to the virus?
Well, it is a shared experience. It's a shared experience for all of us. And so everything that we're all doing, of course, the pregnant woman needs to do. You haven't brought up this particular question, but the feeling is that they're not more likely to get the infection, but if they get the infection, they're a little bit more likely to be a little sicker. And in general, their age, which is usually a little bit younger, usually less than 40 or 42 or so in general terms, that is the part that probably helps them the very, very best. So everything that we're doing as a member of society and in the community in terms of social distancing, and in terms of being very frank and very open about what you're feeling and what you're experiencing, like your symptoms, and also your exposure risk from both sides, the care team and also the patients themselves need to be able to be honest about doing those particular things. So what do? Well, they listen to the news and they make sure that they don't get panicked, and they practice the social distancing. That's the most important thing. The second is they try to be as frank as they can. They come to their visits when they can and as open as they can be and technically able to be. Then when a visit can be separated by a virtual visit, like for example, a video visit or a telephone visit, then they try as hard as they can to be a part of that. That's a little bit of a challenge because it's different than the way that we normally interact, but it still works and it works well. A visit doesn't have to always be a virtual visit. So for example, if in the course of the conversation, we come across something where we think a physical visit might be necessary, we're going to bring the patient in and we're going to kind of instruct them on how to safely be able to do that. So if we just continue the same thing that we've always done, being good stewards as citizens, to practice social distancing and practice staying at home when the orders are there necessary for that, and try to avoid crowds and those sorts of issues. Meticulous hand washing, that's the other thing that's really, really important. And then dialoguing with the physician team, nurses and doctors along the way, we're going to be just fine.
We did have one question that came up while we were talking about tests. It says, if I have a scheduled blood and urine test, how do I go about it? So you mentioned bringing patients in safely. What are we doing to bring patients in safely for their lab work?
Right, that's a really good question. And the way that we do it is we try to create a visit, for example, when you're going to physically see the doctor, when you have to physically see the doctor. And those visits have been we've sort of decided this as we check with the different agencies that help guide us with what the professional guidelines are. These are like the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine. They put out some really wonderful guidelines for us as physicians to be able to utilize and to support. And of course, we make our decisions in the moment of how we take care of our patients. But what we do is, the general idea is we want to create a virtual visit when the patient doesn't have to have laboratory work done or an ultrasound done or something of that nature. And then a real visit, in other words, an actual physical visit, when they do need to have something done. And when they do need to have something done, we want all that to be done at the same time so that they're not exposed out in public, unless they absolutely need to. And when they come in, they're screened at the door for our facilities. And then once inside the door, then that's where the lab work is, that's where radiology is, that's where they see their provider. What we have at Kelsey allows us to be able to do this. And probably every practice can adjust accordingly. Thankfully, we don't have to send a patient out to another place to get lab work or ultrasound done. And we can control at the door who's here and that everybody's been screened, including all the employees. So it turns out to be a little bit safer place than perhaps even at home. But so by limiting the visits that are actual and physical visits and trying to consolidate everything so that it's all done at the same time, that's what we do. And if something in the course of a conversation indicates to us that a laboratory work needs to be done, we'll ask the patient to go ahead and come in.
Okay. So I guess as we're moving through pregnancy, I'm sure we have quite a few patients who are in their third trimester and getting close to delivering. Can we talk a little bit about what's happening at the hospitals? And I know one of the questions we've been seeing floating around social media a lot is whether or not it's safe to give birth at a hospital, or if parents should move to a birthing center. So can you talk a little bit about safety at the hospital?
Right. I mean, I think it's a really, really important question. And, the hospitals are held at a particular national standards. At least certainly I can't speak to every hospital in the United States, but I can speak to the hospitals that we use here in the Houston area. And those hospitals, which are run by the Methodist hospital groups, the CHI hospital groups, and the HCA hospital groups, all are meeting a particularly high standard for how they screen their staff, including ourselves. Even if we're screened at Kelsey, we're still screened when we go into the hospital again. And then all of the staff is screened there as well. The labor and delivery units are typically separate, completely separate, locked units, so people don't move in and out. We don't allow a lot of visitors. Right now, we're still allowing one visitor to stay with mom the entire time, and hopefully not move in and out of the in and out of the hospital, rather. And each hospital tries to sequester their patients that have coronavirus in a separate ward away from labor and delivery. And I don't know of any exceptions to that. And so the patients, when they come in to the hospital, are going to be kept in a separate place that is unique to the labor and delivery area. In the labor and delivery area, there may be a separate place for patients who are actually pregnant, who need to be delivered and also have the coronavirus. And there are national standards as to how we separate those people, who takes care of them, who goes in and out of those particular rooms, that is separate from what we're doing with the general public coming into labor and delivery. That has to happen. And so the next question, of course, is whether it's better to do it in a birthing center or rather than in a hospital. And I would tell you, well, I can understand the concern with other patients physically in the building somewhere that might have coronavirus and that are separated and being taken care of. However, though, I would tell you that because of the high standards that the hospitals are needing to satisfy, birthing centers may not have those same standards. And so one would have to look and make sure that it isn't what standards those birthing centers are utilizing. I'm more confident delivering in the hospital for a couple of reasons. Number one, the commitment of the hospital staff and the physician staff and the nursing staff to meet those professional standards on every level. The second is that if a problem begins to occur, then care can be escalated right there in the hospital. If that begins to happen in a birthing center, unfortunately, you're going to have to be put in an ambulance or in a car and be taken to a hospital where the care needs to be escalated. And I would share with you too that from the experience in New York City, they described a number of obstetric patients that came in for delivery. They did not have symptoms, and then their care needed to be escalated because of the coronavirus over a very short period of time. And they came to find out that they actually had coronavirus. So a person may go in without very much symptoms, and then their care needs to be adjusted as they get into the hospital. And so for that very reason, it would be best, I think, in my humble opinion, to come to the hospital and deliver there instead of at another outside center of some sort.
So since we talked about symptoms in pregnant patients in New York, can you talk about the risk of transmission from mom to baby? Do we have any studies that are out on that yet?
Right, well, we don't have any studies, but what we do is we have some experience internationally. And as we've watched mothers that got coronavirus and delivered their babies, certainly in the Chinese experience and some limited information from Europe, we don't seem to find that mothers pass the coronavirus to their baby. This is called vertical transmission. It doesn't appear to happen that way. Now, once they're born, okay, that's a different story. Then the same droplets of aerosolized saliva that has virus in it can transfer to the baby. And so we have to be careful. If a mother were to have coronavirus, we don't find the coronavirus in the amniotic fluid. We don't find it in the placenta. We don't find it in the vaginal secretions, interestingly enough, and we don't find it in the breast milk. And so when the babies are born, we feel that they're going to be okay. Now, if a mother happens to have coronavirus, we might need to separate mom from the baby until we know that mom can't transfer the infection to the baby. Children, including babies, seem to do a little bit better. They can still get very sick, so we have to be really careful with them. But we do try to separate mom from the baby if mom happens to have the infection. And so that's something to decide kind of at the moment, and that would mean the woman would come in with the coronavirus already present and already identified, and then we would figure out what it is that we needed to do.
Okay. So in terms of treating coronavirus in pregnancy, is there anything specific if a patient were to be positive? Is there any course of treatment that our doctors are following for pregnant patients at this time?
What we need to do. I'm sorry, Elaine, I interrupted you. What?
Oh, no, go ahead.
Yeah, it's a really, really good question. There is no cure for coronavirus. What we have to do is we have to support patients at the time that they develop the infection. Thankfully, because of their age, most of those infections are mild. About 20 to 30% of the patients may need more care, and that care is going to be at the hospital. Right now, you've heard in the media about hydroxychloroquine and azithromycin, as well as antiviral medicines. All of those are in the stages of being evaluated right now. Those medicines can be given to women that are pregnant, and sometimes they are. And in fact, in New York, they're often using that in pregnant patients and finding that they do a little bit better. There's a lot of work that's in the background that's trying to figure out if that's a good idea or not. It seems like it might be, and we're actually really hopeful for that. But since most of the time the problems, the infection is very mild, even for a pregnant patient, what we do is we give them symptomatic therapy at home as long as they can until the symptoms worsen. And just to speak a little bit to those symptoms, moms would have a fever, would feel like they're having the flu, maybe some gastrointestinal symptoms like diarrhea or loose stools, or certainly a change in their bowel habits. They don't feel very hungry. Some of them feel that they lose a sense of taste and a sense of smell, which is really interesting because pregnant women have a very high sense of smell and a very sensitive taste of taste. And so that would be one of the symptoms. And then, of course, the cough and the shortness of breath. And if we get to the point where we're coughing and having any shortness of breath, it's time to come to the hospital.
If a patient feels like they have symptoms, should they call Kelsey first or go straight to the hospital?
You know, it's probably best to call Kelsey because the symptoms are not very specific. And so it's our job, you know, as we talk to the patients to try to figure out, is this seasonal allergies? Is it the flu? Is it just a common cold? You know, and we can watch it at home for a little bit longer. So the best thing to do is really to talk to the doctor. And then from that, for example, at Kelsey, we have a dedicated team for the COVID virus, for the coronavirus, so that if we think a patient might need testing, we kind of work through that particular team within Kelsey to be able to decide how we're going to test those particular patients. So
Okay.
coming to the hospital only if you're really sick. Sorry.
No, that's great. We have some questions that I think we should probably try to answer if we can that were submitted. One of them is, we have a first-time mom who has some questions about virtual visit. She said,
Yeah.
is not being able to hear my baby's heartbeat something I should be concerned with during my virtual visit?
You know, it worries us all. Okay, of course it does. You know, there are, first of all, if you can feel the baby moving, that's very reassuring. And we may not, in those particular circumstances, need to actually hear the heartbeat or measure that particular heartbeat. In the dialogue between you and your doctor, it's really important for you to say, listen, I'm really worried. Can I come in and get the heartbeat listened to? And if a patient asked me that, I would say, yes, come in now. Let's go ahead and do that, okay? Now, we wouldn't want to do that every day because we wouldn't want them to be exposed every day. And the more we can keep them isolated, kind of the better. The virtual visit doesn't mean that we're going to do a virtual visit and never listen to their heartbeat for the entire pregnancy. It means that we do it periodically. So there are some visits that have to be physical visits and some visits that can be virtual visits or video visits. In general, I don't necessarily recommend it because it's kind of tricky, but there are monitors that you can put on your tummy that you can buy from Amazon and different places that can actually let you hear the heartbeat if that reassures you. But sometimes it's even tricky for us to find it, and so we have to play with it a little bit. As long as you promise not to get panicked, that's not a bad thing that you can do. And that can be incorporated in your visit. If a patient of mine, for example, has a blood pressure monitor at home or has one of these fetal heart tone monitors at home and can listen to it and we can listen to it together, that kind of enhances the visit. It's not absolutely necessary though, because the experts have told us that if we periodically see them and periodically do the video visits or the virtual visits, that we're going to be fine. And hopefully this won't last for a long time. It'll last for several weeks to a few months. And then maybe there'll be flares nationally throughout the country over the course of a year or so. But hopefully we'll be able to come back to seeing the patients and listening to the heartbeats and all of those sorts of things. But I think the key here is the dialogue. In other words, if a patient tells me that she's really worried, I'm going to listen to that and I'm going to have them come in.
So we have another question that was submitted. Can it be dangerous for baby?
Lane, it kind of cut off for me. So, I mean, I'm seeing you, but it went really slow. Can everybody hear me? Okay. Okay, try it, Lane.
Okay. If mom spikes a fever, is it dangerous for a baby?
Well, if she spikes a fever for a long period of time and it's untreated, we think that might put some stress on the baby. It's true, because the baby can't separate themselves from mom and lower their temperature. But we're talking about high fevers without medication. So if you had a fever that was over 100.1, then I would want you to call the doctor's office and get some more instructions. And that might mean kind of screening you for those other questions. You can always take some Tylenol. There's no problem with that in pregnancy, and we can bring down the temperature, and then continue to monitor from there. Sometimes it may mean bringing mom into the hospital, to evaluate a little bit further. It just depends. But a fever that's isolated that you identify, whether you're having the flu or whether you have, heaven forbid, the coronavirus, that those fevers, are easily treated with Tylenol typically, and they shouldn't cause any harm so long as we treat them.
Okay, so I think we have a few more questions. One of the other questions we had is, if my spouse or partner works on the front line, should I limit his or her contact with my baby after delivery?
I think that's really a great question. It's something that the world has grappled with, okay? And I'll give you an example, an extreme example. In Wuhan, China, when the doctors and the caregivers that were actually taking care of patients that were sick, those people were sequestered away from their families in a singular place so that they wouldn't go home and pass it to their family, okay? But what we learned that if the caregiver uses the protective equipment that's necessary, if it's available, and wears a mask in the interaction with patients that might potentially be ill, and that when they go home, they monitor their symptoms, and also they change their clothes, perhaps even shower before they interact with the family. If they're doing okay, and they've done those things with the protective equipment, the masks and gloves, and washing their hands meticulously, showering before they interact with the family, they're going to be fine. If you do that, there have been no incidents of workers, passing the infection to family. When you lose or you drop that particular discipline, well, that's when the problems can happen, because the virus is spread by aerosolizing saliva that has the virus in it. So if you have a lab coat, or if you have clothing on, or if you have it on your skin, when you go home and you interact with your family, well, then there is a risk of passing it. But on the other hand, if the doctor and the caregiver and the nurses and all of the staff, make a disciplined plan for, they get home, they change, they shower, they wash everything off, they, wash those clothes separately. And if you just wash the clothes, that's good. That'll take care of it. If you do that, then you should be fine. And so, no, we wouldn't want, a new dad or, a new partner to not be able to be with their baby and their family. But the way to do that is just to be meticulous about that.
Okay. And then I think we have one more question that was submitted, and it was asking, do you have any tips about dealing with anxiety during this period?
Probably the biggest tip is to share, to share your experience and to share the things that you're worried about with the doctor and with the nurses and the team that's taking care of you. Everybody gets scared. I mean, as we're watching the news, the information and the images are startling. Part of that question that somebody asked earlier, which is what's going to happen when you go into the hospital, is that we see these images of emergency rooms that are just bursting with patients in the hallway and everywhere, and it seems like, well, that I don't want to deliver a baby there, and so I think that when we dialogue together and we share our experiences together, I think that we can put what our experience is going to be in the hospital in the context of how it truly is. So for example, when I tell you labor and delivery, we don't deliver anybody in the hallway with all those patients. We separate them in their own little area, you know, where it's safe and it's clean so that they can take care of their baby. And then after we deliver them, we keep them in the same room. And we make sure that the people that are coming in have been screened before they come into the rooms. And then we try to get them out of the hospital as quickly as we can so that we can get them home and in a place where they're safe. You know, I think that as we talk and as we share this experience together, I think that's probably the most effective way of dealing with the anxiety. And then the other thing too is to try to perform the things that our community leaders are trying to encourage us to do. Like for example, the social isolation or staying at home and not going out unless you absolutely need to. Listening for those things to change. There are going to be areas in the community where we're going to see a large spike in activity of the coronavirus. And that may change the way that we look at things or the way that we behave in those particular areas. Whereas in other parts of the city or other parts of the community or the state or even of the country, we can be a little bit more lax because things aren't so bad. And when they are, then we have to be able to respond and to be able to change and to be able to adjust. And so part of the anxiety is to listen and to be good stewards of your community and of your family, which is the most important people that you need to pay attention to and be careful of. And if you do that, you're going to be fine. It's true. The noise and the reports are going to get scary, and they may get scarier because it's felt that over the course of the next several weeks that the numbers of people that are going to get sick and that are going to get sick enough to die, unfortunately, those numbers are going to increase. And that's just part of the nature of how this virus passes through the community and through the communities and through the country, in the same way that happened in China and in the same way that has happened in Europe. But, you know, if we do all the things that we need to, then the chances of dying are lower. That's the key. And though it doesn't seem like we're doing very much when we're just staying at home, you know, that makes an enormous difference. It takes the death rate from, you know, it drops the death rate significantly. And so, you know, don't give up and don't panic. There are a lot of really hard, really significant and diligent and smart people that are working on this every single day to try to keep it safe for all of us. You know, not just your doctor taking care of you, which of course that person would do that, you know, no matter what. And by the way, viruses and pregnant women have been happening since time began, and they're going to continue to happen. And we're going to make it work, and we're going to get through this just fine. But we have lots of really smart people that are giving us good recommendations and good advice. We just have to try not to panic.
Do you have any other advice or parting words that you want to give to patients before we go ahead and wrap this up?
You know, maybe a few. You know, I think that you can't undervalue washing your hands. You can't undervalue trying not to touch your face. And by keeping people together and separate from each other, as well as when somebody gets sick, putting them separate from the people that are well, like for example, at the hospital, and taking care of them and making sure that they're okay before they go back into the community. You know, I mean, I think that that's probably the best way that we'll get through this. When we become very lax in that, when we become frustrated by that and want to go and be with a bunch of people, now that's when we actually get into trouble. And so, you know, that's probably the biggest encouragement I would give everybody. I'm going to talk about one more thing too, which is about masks. And whether you should wear a mask at home or whether you should wear a mask in public or when you're around people. You know, the experience through Asia, whether it's Singapore or Hong Kong or even China, it's very common, or Japan, it's very common for them to wear masks. That's part of their normal thing that they do, especially during the winter season. Whereas here in the West, it's not such a common thing that we do. And so it feels a little awkward and it feels a little odd and maybe even overreacting. But if you think of it as being an extension to social distancing, then then you shouldn't feel bad about wearing a mask if you choose to, or you want to, or it makes you feel any better to do that, or any safer. What the studies have shown us that certainly in the setting of the hospital, or in the clinic sometimes when you're taking care of patients, a mask might actually be a really helpful tool. We're going to see. And so don't be too nervous or don't be too frightened if the doctor comes in and they're wearing a mask, or the nurses or the medical assistants that are taking care of you, are wearing masks. Because in the setting where we're seeing a bunch of people together and we have to be together in order to take care of each other, a mask might be helpful. For the general community though, if you're at home, no, you don't need to wear a mask, with other people. If you go into the community, for example, if you were to go on the bus, or if you were to go on a subway, or you were to be in somewhere where it's a little bit more crowded and you can't create that social distance that we're talking about, maybe a mask isn't an unreasonable thing to do. And when you get home, if it's a washable mask, you take that mask off. Remember, the outside of the mask is the part that could potentially have the virus on it. So you're careful when you take it off that you're just touching the inside of the mask, and then you wash it, or you throw it away and use another disposable one, whatever you have available. But don't think that you need to go out and buy a mask or anything like that right now. But if you hear on the news talking about masks, that's the idea that's kind of behind it.
Great, I think that's wonderful. Well, let's see. We had one more question come in. If you have time to answer this one, and then I think we'll wrap up.
Okay.
This is regarding registering for the hospitals and taking classes. So we have someone who hasn't registered yet or taking a hospital tour. Do we know if hospitals are moving any of this online? I know at Kelsey, we're going to be preparing some videos and courses for our patients as well, like we would do with Baby on the Way and things like that. So patients can be looking for that. But have you heard anything regarding Houston area hospitals?
Well, things have been moving very, very rapidly. And so the first step, of course, was to make sure that we're going to limit crowds and we're going to limit access to the hospital. Hospitals, had been, before this coronavirus event, had a function of being a community center as well, like, for example, for pregnant women. And so for right now, those things are on hold. And your team, Lane at Kelsey-Seybold, and our team is trying to gather the information from the community of what's available and to see if any of the hospitals have gone to doing something that's virtual. We know that this is a need. And so what we're going to try to do is, if they haven't, we'll create our own. And so look to our website. There should be resources that are there for labor support, as well as for lactation support in the time of this COVID virus pandemic. With regard to registering, what I would encourage everyone to do is simply to call the hospitals themselves. And I think that everybody in the hospital is pretty good about doing these things by telephone or online, because they don't want patients there unnecessarily. So I'm encouraging them to do that. I don't know specifically of each hospital, but I know that all of them are trying to do the same thing. So just check with your hospitals. I think they'll have something for you.
Perfect. Well, I think we're going to wrap up for today. And as we said before, if you have any other questions about coronavirus, please feel free to contact your OBGYN during normal business hours at the office. They'll happily answer those questions for you. If you have any concerns about your pregnancy, you can call the 713-442-BABY for the after-hours nurse at night and weekends. And if there's a need, they'll page the doctor on call. And thank you guys all for tuning in. And if you have any other questions, please feel free to reach out to us. All right. Thanks, Dr. Sam.
You're welcome. Bye-bye. Everybody be safe.